So we're going to be doing range of motion for shoulder extension. So the partner is going to be lying prone on the table with their arms in neutral along their side of the body. The axis of rotation is going to go at the center of the glenohumeral joint, and the stationary arm is going to be aligned with the mid-axillary line of the body, while the mobile arm is going to follow the humerus as it extends backwards. So go ahead and do extension. And the normal range of motion for this is 40 to 60 degrees, and she has about 35 degrees of motion.
35.
Okay, so we're going to be doing range of motion hip internal rotation. So the partner is going to be sitting upright on the bench with the knees in flexion hanging off the edge of the table. The axis of rotation will be on the anterior aspect of the patella. The stationary arm will be perpendikilar to the floor, aligned with the tibia, and then the mobile arm will follow the tibia as internal rotation occurs. So she's going to kick her leg out to the side, and she has about 35 degrees of internal rotation. The normal range of motion for internal rotation is 35 degrees. Okay, we're going to be doing range of motion, cervical flexion with the inclinometer. So the patient is going to be sitting with head in neutral, and we're going to place the first inclinometer on the C7 process, and the second inclinometer on the top of the head, being sure to make sure that the inclinometer is put at 0 on both inclinometers. And the partner is going to go into cervical flexion, so bring the chin towards the neck. They started at 90 degrees and ended at 120 degrees. Therefore, their range of motion is 30 degrees of cervical flexion, and normal range is 50 degrees of cervical flexion. So we will be doing manual muscle testing of the supinator. This performs supination of the forearm. It originates at the lateral epicondyle of the humerus and inserts at the proximal third of the radius. The patient will be in 90 degrees of elbow flexion with their palm facing up in supination. I will be stabilizing at the elbow, and my other hand will be at the wrist joint, and I will be pulling into pronation while the partner resists and tries to stay in supination. This action occurs in the transverse plane along the longitudinal axis, and I would give this a score out of 5. I would give it a 5. This is manual muscle testing for the biceps femoris long head. The biceps femoris long head muscle action is hip extension, knee flexion, and hip external rotation. The origin is the ischial tuberosity, and the insertion is the fibular head and the lateral condyle of the tibia. So for this muscle, the biceps femoris long head, it is the lateral hamstring muscle in the hamstring muscle group. And for this, the partner will be lying prone, the knee will be flexed, and the foot will be put into external rotation. The knee will be moving in the sagittal plane, and that is the medial-lateral axis. So both hands will be placed on the ankle, and I will pull into extension while the partner resists and tries to maintain flexion. For this, I would give a score of a 5. We will be manual muscle testing the external obliques. The external obliques perform trunk flexion and lateral rotation. They originate from ribs 12 through 4, and they insert on the linea alba, pubic crest, ASIS, and the iliac crest. So for this manual muscle test, the partner will be laying supine, and I will be holding her ankles. She'll put her hands behind her head. This is a score of 5 if she can complete the motion. So she'll flex and try and bring her right elbow to her left hip to get the lateral rotation. This occurs in the sagittal and transverse planes, and this scores a 5 due to her arms being behind her head.